Good day everyone. So in our last video we saw about the standardization, the speed of the paper and then how to analyze the rate of an ECG. Today we will talk about how to analyze the rhythm on an ECG. So what exactly do you mean by sinus rhythm? When someone says it is a sinus rhythm on an ECG, what do you mean by that? When you say sinus rhythm, you mean that the pacemaker of the heart is where it should be, that is in the right atrium at the SA node. And this impulse is then transmitted all across the atria, what we will refer to as the A. And from the atria, it goes into the AV node, and via the AV node, it gets transmitted to the ventricles, what we will refer to as V. So here if you see this impulse which is starting in the atria, causing an atrial contraction, then being transmitted to the ventricles, causing a ventricular contraction, are in sync with each other. So this atrial contraction is then followed by this ventricular contraction, or you can say this ventricular contraction is preceded by this atrial contraction, or this QRS which indicates ventricular contraction is preceded by a P wave which indicates atrial contraction. So this P and this QRS are in sync, or in other words, this is known as AV synchrony or AV association or AV synchrony, meaning that this P is married to this QRS and this QRS would not have occurred in the absence of this P wave. So when you say sinus rhythm, that is what it means. So how do you recognize a sinus rhythm on an ECG? Is it enough to say that there should be one P wave and following this there should be one QRS with a regular RR interval? Is that enough? Let's take that example. Here you have a P wave, QRS, P wave, QRS, P wave, QRS, P wave, QRS. Now here if you see this R, the interval between two R waves, the RR interval is constant. At the same time, there is one P and after this there is one QRS. Everywhere there is one P and then there is a QRS. But is this a sinus rhythm? No. Why not? Because if you look at the PR interval, the PR interval is varying. Here this PR is shorter, this PR is longer, this PR is almost very short, and this PR is completely vanished and the P is almost merged into the QRS. So the absence of a constant PR interval indicates that this P is not married to this QRS. Think of the PR interval as the marriage certificate of the P and the QRS. If your PR interval is constant, it indicates a constant relationship between the P and the QRS, or it indicates that this P is causing this QRS, this P is married to this QRS. In the absence of the marriage certificate, it means that the P and the QRS, if seen together at any point of time, it is purely coincidental and there does not exist a relationship between them. So there has to be a constant PR interval for you to say that it is a sinus rhythm. Look at this. See that? There is one P, following this there is one QRS, and now the PR interval is constant. This PR is equal to this PR is equal to this PR. So this is a sinus rhythm, whereas this is not a sinus rhythm. So if this is not a sinus rhythm, then what is it? It is known as, remember when we said that there is sinus rhythm, there is AV association. So in the absence of sinus rhythm, this is known as AV dissociation. So how do you differentiate AV dissociation from sinus rhythm? What are the points? You have AV dissociation and you have AV association, or you have sinus rhythm. So what happens over here? Your PP interval is constant. It is constant in AV association as well. This is sinus rhythm. The RR interval is constant. It is constant in AV association as well. The PR interval is variable in AV dissociation, whereas it is constant in AV association or in sinus rhythm. So to say it is sinus rhythm, we should have a constant TP, a constant RR and a constant PR interval. Now, there is another catch over here. Suppose you have lead 2 and you are seeing this. Now here again you are having one P, and following this P you are having a QRS. You are having a P and a QRS. You are having a P and a QRS. P and a QRS. PP regular, RR regular, PR regular. Is this sinus rhythm? No, it is not. Why? Because look at the P wave. The P wave in lead 2 is normally supposed to be upright, but here the P wave is inverted. So this indicates that the P wave axis is abnormal. So you should have a constant PP interval, a constant RR interval, a constant PR interval, and your P axis has to be normal, indicating when you say a P axis is normal, the P should be upright in lead 2, 3 and AVF as well as lead 1, and the P should be inverted in lead AVR. So that indicates that it is a sinus rhythm. So what would you call this rhythm where the P, everything is fine, but it's just that the P is now inverted? This indicates that the rhythm is still arising from the atria. So the conduction across the AV node is okay. The conduction to the ventricles is okay. There is only one impulse which is coming from the atria, which is coming towards the AV node. But it is not coming from the SA node. That is the reason why it is a different morphology. If it was coming from the SA node, it would be upright. But now it is coming from somewhere else. That is why it is inverted. So something which is coming from a position where it normally does not come is known as ectopic. If you have a pregnancy in the tube instead of in the uterus, it's an ectopic pregnancy. So now here you have an atrial impulse which is coming from elsewhere other than from the SA node. So it's an ectopic atrial impulse. So this is an ectopic atrial rhythm. Now one of the other common causes of having an inverted P wave in lead 2, 3 AVF and having an upright P wave in AVR is lead inversion or lead reversal. But in lead reversal, along with your P wave axis changing, even the QRS axis changes. So here P axis changes and QRS axis also changes. Both of these change. Whereas in ectopic atrial rhythm, only the P axis changes. The QRS axis remains normal. Okay, so we'll come to that when we talk about lead reversal in detail. So now, what if you have a rhythm where you do not have P waves, but you have only regular QRSs? You have an RR interval which is regular but absent P waves. This is a junctional rhythm. Now suppose you do not have P waves, but your RR interval is now irregular. Yeah, the RR interval is now irregular. This is short, this is long, this is long, this is short. So absent P, irregular RR. There is only one diagnosis, that is atrial fibrillation. Absent P wave, irregular RR interval, there is only one diagnosis in cardiology on the ECG, that is atrial fibrillation. So this is in brief about the rhythm. Next, I will try to get you some ECGs. What I thought is I'll try to get some ECGs of sinus rhythm, of AF, of junctional rhythm, and I'll prepare a short presentation video in which I'll show these ECGs and then we'll discuss the ECGs. Meanwhile, if you have any ECGs that you want me to discuss on the channel, send them across to my email ID. You know it. If you don't, here it is: drmdsadiq cardio@gmail.com. Alright, so send across your ECGs that you want me to discuss and I'll try to incorporate them as best as possible. Until next time, thank you and God bless.